Hello, Dr. Jere here with Mills Chiropractic and Wellness Center. And this month we're really kind of diving into chronic pain. And I wanted to spend a little bit of time just kind of talking about this concept a little bit. So chronic pain is any type of pain that lasts, and it kind of depends on the definition. Some people say 6 weeks, most people say at least 3 months, but any type of pain that is persistent or continues to reoccur over time has the potential to be chronic pain. And we can feel that pain. It's like anything. The more we practice something, the better we get at it, right? And that's one of the problems with pain as well, is that the more we experience it, the better we get at experiencing it. And it kind of becomes this double-edged sword, right? And so one of the big challenges in healthcare, really forever, but has really been brought to light in the last couple of decades, is this chronic pain that exists with people. A lot of times it's joint pain or nerve pain or muscle pain or different types of musculoskeletal pain that starts out at least as an original injury or an original pain, but then through a number of convoluted things, basically it can become more of what we call centralized pain, which is the injury is actually healed, but the brain has gotten so good at feeling the pain that it still perceives the pain, kind of like phantom limb situations. And this is just, like I said, such a big topic, and I'd love to get into the details of it and explain all of it. But again, unfortunately, these videos are designed to be short and sweet and kind of to the point. This would really take like a month-long seminar if we were to really dive into it. But again, it's such a fascinating thing, but it's such a big problem. And one of the reasons that it's such a big problem is that there's not a great pharmaceutical solution for it, right? And yet that's what tends to happen in our society, unfortunately. And it's this snowball effect, okay? So typically, I'm going to talk a lot about opioids in this month because that's kind of the ultimate treatment for these problems. But a lot of times these problems start out, taking an ibuprofen for a month or so, and then that stops working because our body becomes adapted to it, and the injury is continued, it's never been addressed, and then we move on to, a different painkiller, maybe a higher powered anti-inflammatory, and then if that doesn't work, we move into the steroids, and those tend to work for a little bit, but not for long term, and then eventually, unfortunately, a lot of these patients, and maybe you yourself, have seen this rabbit trail that ultimately ends in opioids. And opioids were being prescribed like candy a couple of decades ago, and we're still reeling from the consequences of that. They're still being prescribed way too much, way too often. And so what the research has really been showing is that you got to address the underlying issue, even if the pain has become centralized. And that's where movement therapy and chiropractic comes in. Some of the big stats right now that's coming out is, chiropractic can reduce the use of opioids by over 50% if patients would see a chiropractor. The other medications, we see similar statistics, right? If you see a chiropractor, 50% less NSAID use. If you see a chiropractor, 50% less Tylenol use, and then it progresses all the way up into even the opioids, which is, by the time we get there, unfortunately, a lot of times by the time patients show up at the office here, they've been dealing with these problems, and perhaps they've already been the opioid pathway, and then they either had to back off or they stopped working because there is a threshold, it keeps, we need more and more to suppress that symptom because it's really never being addressed from a medication standpoint. And so I don't want to get lost in the weeds with things, but I want everybody to know that, if you know somebody experiencing chronic pain, and pain that they've complained about before, or maybe you yourself have this chronic underlying issue, see a chiropractor. Yeah, we may not be able to completely resolve it at times. There's situations where certainly we cannot, but we can reduce that dependency and that need for these next level medications, and hopefully we can catch them before they get to that point that they're addicted to these opioids, because there's still, it breaks my heart, there's still 100 people every single day dying of opioid overdoses still today. We kind of hit an apex of about 6 years ago, 5-6 years ago, when we were seeing almost 200 deaths a day. So we've come way down, but that's still way too many people. A lot of these people are young, active people that have a whole lot of life left ahead of them. So it just, like I said, it just kind of breaks my heart that these are the options given to patients. So anyway, I hope you got something from today. I know we could go into a lot more depth, and I know a lot of there's a lot of nerds out there like me that really kind of enjoy understanding pain, and that's a good book, by the way. If you have chronic pain, Understand Pain, go for that. But anyway, sorry, got off topic. I hope you got something from it. Until next time, stay healthy, stay well.